5 most common signs which indicates that your child might need braces. I'm Dr. Olga Dolghier, board-certified pediatric dentist here at Palm Valley Pediatric Dentistry and Orthodontics. What are those signs? Sometimes you look at your kid and you're like, should I take them or not? Because the teeth look kind of crowded, but they're straightening out, but she doesn't look right, or he, so it's kind of difficult to decide. So let professionals decide for you when and what age is the best for your child to have braces. There is 2 different phases. There is phase 1 and phase 2. Phase 1 is when we place braces early, and there is a couple of indications for that. And phase 2, sometimes it's a follow-up after phase 1, about 3 years later, or it's just one phase technically. We call it phase 2 because there is no more baby teeth, it's just adult teeth. So what are those top indications? Let's talk about phase 1 first. Number 1, if your child is extremely narrow and crowded, if you look at their mouth and all the teeth are overlapping and their jaw looks small and almost restricted, and your kid also breathes through the mouth when they sleep, they might need an expander. The child who has crossbite, back teeth crossbite, or front teeth crossbite. Crossbite is when the top teeth are under the bottom teeth. This is crossbite in profile. They may need a special expander to make the jaw wider. It actually improves not just alignment of the teeth, also bone and skeletal structures. For example, think about it. Your nose, you breathe through your nose, you eat through your mouth, and the palate is like a connection plate. So the wider the palate, the wider the floor of your nose. That's all interrelated. So airway obstruction sometimes plays a huge role. So when we see little ones, it's important to screen for that airway obstruction and restriction. Number 2, if your child was born and they have very heavy jaw on the bottom, so those kids will need phase 1 as well. We call it class 3 malocclusion, is when the mandible lower jaw becomes kind of overgrowing or upper jaw is deficient. We never know which one, but we have to have special measurements. That's number 2. And number 3, extreme crowding. So those are main indication for phase 1. If your child past that age, phase 1 we do usually between 7 and 10. That's kind of a bulk of the patients which have mixed dentition. They still have baby teeth, they have adult teeth. So we're technically preparing a jaw of a child for adult teeth to come in straight. Or we can do, as I said, phase 2. Phase 2 is usually done on kids who have no baby teeth left. There's so many different indications. Can be aesthetic, for example, teeth overall look nice, but you don't like how narrow your teeth are or jaw is, and crowding. Some teeth are not aligned properly with other teeth. So it could be cosmetic. And if it's cosmetic, aesthetic, a lot of times we do Invisalign, kind of clear retainers, which are easy to manage. If there is a more complicated problems, for example, root of the tooth is not straight. Like I have braces right now because Invisalign could not move my root of the tooth in the back. So braces will help with that. It's kind of more complex approach, and we not just moving teeth around, we actually can move the whole root and just change position of the teeth. So could be another indication. Also misalignment of the teeth, if you're class 2, or we call it buck teeth. That's cool, I know they used to call it that way, not a good name, but some kids have very severe overjet, is when the front is kind of sticking out very far forward. First of all, it's dangerous because they can break the teeth or even evolve the tooth in contact sports, so they have to have those sport mouth guards when they're playing. But we can bring the jaw back a little bit, or kind of extend lower jaw slightly, and kind of make that alignment of the teeth more balanced. So those are main indications for the phase 2 orthodontics. So crowding, again, class 2s or class 3s. Sometimes nothing can help. Sometimes we look at the older child especially, and the jaw is very overgrown. It's kind of 100% over the upper jaw. In this case, your orthodontist may suggest waiting until child is done growing and do actually orthodontic surgery. Surgery is when we reposition the jaw surgically and places braces on. There is so many different indications, but keep an eye on your kid. Make sure when they do have their adult teeth in, we usually like to see them for first screening at the age of 7 or 8. When the first back teeth come in, the first adult molars come in at the age of 6. So that's when you kind of start looking. And between 6 and 8, you're gonna get 4 and 4 front permanent teeth. And then we can do something about it. We can widen the jaw, we can do basic phase 1 orthodontics to improve and prepare child for a better alignment of his adult teeth. So orthodontics is complicated. My job as a pediatric dentist to screen everybody who needs it, who not, and send to a board certified orthodontist in our practice or different practice who can take care of braces. So share with me your experiences. How did you have braces? Did you have to do them twice? Or did you have Invisalign and then you had to switch to braces like I did? I'd like to know. Thank you so much for watching my channel and see you in next video.